Welcome back to Health Talk. I'm Dr. Kenny Levine. I'm here with Dr. Maria Escabi and Dr. Paul Garcia, who are general dentists who practice in Sunrise. Tell us a little bit more about your practice, Maria.
Well, in our practice, we do comprehensive dentistry. We do from fillings, extraction, um, pretty much everything, every aspect of dentistry. We see little kids, we see the elders, and we try to cover every aspect of dentistry there. Um, the area that I work the most is with root canals, the endodontics aspect of dentistry. But generally, I work with every aspect.
Well, wait a minute. You and I did a case that was incredible. We
Yes.
had this gentleman who was a former fire chief in Sunrise, and he had worn his teeth flat. And between you and I, you created a magnificent smile for him.
Thank you, thank
And
you.
I actually saw Norm today, and he was in, and he loves his smile, and he had only the greatest things to say about how we worked together and what you
Yes.
did for him.
Yes. Oh, that was a great case, and we worked together very well, and it was very interesting. It was a nice cosmetic case. We did the full mouth reconstruction, and Norman was the best patient that we could ask for.
Did you have to do any root canals for him?
No,
No.
he didn't need any of that.
No, it's interesting because he had teeth that were worn almost flat,
Yes.
and sometimes you think those are the teeth that are going to need root canals. My mentor, Dr. Amsterdam, told me that sometimes you can have a tooth that you can hit with a blowtorch and it'll never need a root canal. Another tooth you can look cockeyed at and all of a sudden
Right.
it'll need a root canal.
Right. Well, he
Yeah.
has his teeth were fairly they didn't have decay. They were fairly good. It was the bite that it was causing all the problems in his mouth.
Right.
He has a very severe. The teeth were severely worn down, so that's the reason why he needed all the reconstructive work.
But, you know, one of the things that make us unique, because we are, the three of us together, sort of like continuing education junkies. We travel
Yes.
all over the world learning things. In fact, we met each other up at
Charlotte.
in Charlotte, North Carolina, with Dr. Nash. We didn't realize we were going to be there together. And dentistry has changed tremendously. And the dentistry that our patients experience today is not the dentistry of our parents or our grandparents. It's all new. It's less invasive. It's kinder. And the materials are different. Paul,
Right.
what materials are different today?
Well, I want to just go back to what you said about it's not the same dentistry. I mean, we finished dental school in '94 and she finished in '95. And I tell my patients, this is a profession where you cannot stop learning because new techniques come out every day, new materials come out every day. For example, we introduced in our office last year, in April of last year, we introduced the CAD/CAM technology, which is computer-assisted design, computer-assisted manufacturing of porcelain crowns that we can do in our office now. And so the patient, if somebody, let's say, breaks a tooth, and somebody who's in a really busy schedule, they don't have time really to, come back twice to the office. What we can do today is basically we prepare the tooth for a crown, for a cap, and then using the CAD/CAM technology, we just take pictures with a laser. Basically, it's an intraoral camera basically, and we pick images of that preparation without even taking an impression, and that goes into a computer software. The computer designs the crown, the anatomy, and that goes to a milling unit where we put a porcelain block. We put it into the milling unit, and the patient in that 12-15 minutes of time that takes the machine to mill the crown, he can be watching TV, reading a book, texting, taking care of business, and at the end we have a beautiful crown. The anatomy is outstanding.
What about the aesthetics of it? There are different colors, porcelain, and,
Right.
and can they be characterized
Absolutely.
and stained?
The porcelain blocks, they come in different shades. Okay.
Right.
And if you want to add some characterization to make it look more like a natural tooth, if you want to create some darker fissures or pits, our technician is trained to go and do the characterization with stains. That goes in the oven for 20-25 minutes, and at the end we just cement the crown.
And that's all done at your office?
That's all done at our office. It takes probably like 2.5 hours from start to finish. It does not mean that we are working on the patient for 2.5 hours. It just gives the patient the opportunity to have the restoration done in one visit, You don't have to wear a temporary crown for
Right.
2 weeks, which is usually what is done, and we don't have to take impressions. So it's a great, opportunity for the patient to.
Next time you come on, we're going to talk about the advances in dental materials and how things have changed from silver fillings
All right.
to tooth-colored restorations, because the cosmetics are incredible today.
Absolutely.
We're going to be right back with Health Talk, and I will speak with you soon. Thank you.